Welcome to our training session on reporting requirements for critical circumstances and conditions. Training objectives. Understanding the significance of immediate reporting to protect patient safety and well-being. Ensuring compliance with institutional policies and legal responsibilities. Improving the overall standard of care by preventing neglect and abuse. Reinforcing communication among healthcare teams to enable effective interventions. The importance of reporting. Reporting critical situations is crucial for safeguarding patient well-being, enabling prompt action, ensuring compliance with regulations, coordinating care effectively, supporting informed decisions. Preventing health deterioration, assisting families, maintaining ongoing monitoring, and promoting accountability. It allows for timely medical response, strengthens collaboration among healthcare teams, and ensures precise documentation of patient care. Healthcare professionals and caregivers must remain vigilant in recognizing signs of distress, deterioration, or emergency conditions and act swiftly to notify the appropriate personnel. Failure to report such circumstances can result in serious consequences, including harm to the patient, legal repercussions, and diminished care quality. Key elements of critical reporting. Timeliness: report as soon as possible within hours or minutes, depending on the situation. Accuracy: include specific details about the event, people involved, and actions taken. Clear communication. Use concise language to avoid confusion. Compliance with regulations: follow legal requirements for reporting specific conditions. Important changes in pediatric patient condition: caregivers must report sudden or significant changes in a child's health, such as severe behavioral changes, difficulty breathing, neurological changes, chest pain, severe bleeding, or alarming symptoms. Early recognition and quick response are vital to minimize long-term complications. Mental or behavioral health crisis signs: sudden changes in behavior or mood, confusion, hallucinations, or irrational behaviors. These may indicate stress, trauma, or psychiatric disorders requiring immediate intervention. Respiratory distress and complication signs: difficulty breathing, rapid or shallow breathing, cyanosis, or agitation due to low oxygen. In infants, irritability or poor feeding may indicate severe respiratory issues. Cardiac events and complication signs: chest pain, shortness of breath, dizziness, sweating, or palpitations. In children, look for discomfort, rapid breathing, or lethargy. Sudden neurological changes signs: behavioral changes, motor difficulties, vomiting, seizures, or vision changes. These may indicate neurological issues requiring urgent attention. Infections and worsening of chronic condition signs: fever, redness, swelling, or increased pain around wounds. For chronic conditions like asthma or diabetes, watch for worsening symptoms such as difficulty breathing or extreme blood sugar fluctuations. Falls and accident signs: difficulty moving, extreme pain, swelling, or bruising after a fall. In infants, look for irritability or reluctance to move a body part. Uncontrolled or severe bleeding signs: severe bleeding that won't stop, blood and vomit, stool, or urine. In children, excessive crying or irritability may signal internal injury. Severe dehydration or malnutrition signs: dry mouth, reduced urine output, sunken eyes, or irritability. Malnutrition may cause extreme weight loss, weakness, or fatigue. Refeeding syndrome is a risk in severely malnourished children, occurring when nutrition is reintroduced too quickly, leading to dangerous shifts in electrolytes and fluids. Careful monitoring and gradual feeding are essential to prevent complications such as heart arrhythmias, muscle weakness, and respiratory distress. Medication issues signs: missed doses, incorrect dosage, unexpected side effects, or allergic reactions. In children, watch for unusual fussiness or behavioral changes. Other conditions choking in children. Supervise closely during meals, cut food into small pieces, and keep small objects away. Poisoning incidents, report immediately for food poisoning, carbon monoxide, lead, or pesticide exposure. Abuse. Types of abuse: neglect, failure to provide essential needs like food, shelter, or medical care. Physical abuse, intentional harm such as hitting, burning, or fabricating illness. Sexual abuse, forcing or enticing a child into sexual activities. Emotional abuse, persistent mistreatment impacting emotional development. Financial abuse, restricting financial independence or mismanaging assets. Signs of abuse: physical abuse, injuries on soft tissue areas. Fractures in non-ambulatory infants, or multiple fractures in various stages of healing. Sexual abuse, unexplained bruising, genital pain, or sudden behavioral changes. Emotional abuse, excessive fear, withdrawal, aggression, or low self-esteem. What caregivers must do: immediate action, ensure the child's safety by removing them from harmful situations. Reporting, report suspected abuse to authorities like Child Protective Services, CPS, within 24 hours. Document the incident, including the child's name, age, and details of the abuse. Confidentiality, the reporter's identity is confidential, and legal protections are in place for good faith reports. Failure to report suspected abuse or neglect can lead to legal penalties. Caregivers must remain vigilant and follow reporting protocols to protect children from harm. Considerations for pediatric patients: children, especially infants and toddlers, may not be able to communicate distress. Caregivers should watch for developmental milestones, speech delays, and nonverbal cues like crying or body language. Confidentiality and protections for reporters: the reporter's identity is confidential unless required by law. Georgia law offers immunity for good faith reports, even if unfounded. False reporting can result in legal penalties. Handling sensitive situations: interview children calmly with age-appropriate, open-ended questions. Discuss concerns with parents sensitively and notify supervisors promptly. In suspected abuse cases, involve law enforcement or Division of Family and Children Services, DFCS, instead of confronting the family, unless it's an emergency. Death of a child: any child's death with suspected abuse requires investigation to rule out maltreatment. Caregivers must investigate the circumstances surrounding the death, including medical conditions. If abuse is suspected, inform your supervisor immediately. Summary: in any emergency situation, it is crucial for caregivers to report immediately to their supervisory personnel. Prompt communication ensures that proper actions are taken to address any concerns, whether related to medical emergencies, abuse, or other incidents affecting the individual's safety and well-being. Caregivers must remain vigilant, observing for signs of neglect or harm, and adhere to established protocols for reporting. Your attention to detail and swift reporting is essential in maintaining high standards of care and safeguarding the individuals we serve. Thank you for watching the Reporting Requirements for Critical Circumstances and Conditions module. Please answer the questions for this training before moving on to the next training module.